Podcast Edition. I'm your host, Dr. Caleb Slater, here with Chris, who hates physical therapy.
Hate it.
This week's episode is about physical therapy.
Oh,
about
wow.
your typical physical therapy journey, the positives, the pitfalls, the negatives. Before we get started, make sure to like and follow us on our social media, TikTok, Instagram, Facebook, YouTube. We are also on Spotify for this podcast. And then, of course, our website, thespinaltruth.com, if you'd like to set up a consult or a session.
Or find our courses.
Or find our courses. And our consult or session, either in person or via telehealth.
That's right. You know, I've never been to physical therapy.
No, not once?
I mean, I've taken my kid to it, but I've never had to go through physical therapy treatment.
What was your impression when you took your kid?
It was a madhouse. She walked on a treadmill for 10 minutes, and then she sat there with a hot pack on. Meanwhile, there's a bunch of people going back and forth to this one kid who's like 24 years old, and I'm just sitting there watching this unfold, and I'm like, she walks away. We spent 45 minutes there. I'm like, what did you do?
How much did you have to pay?
It was like $60 or something.
And how many times was she supposed to go?
She went like every week for like months.
Yeah.
And I'm like, what are you doing?
Did it help?
Hell no.
By the way, I told you it wasn't going to help.
It wasn't up to me. Ask my ex-wife. I don't get to say anything.
I know, but I told you.
Yeah, well, and I agreed.
Yeah, and unfortunate, you're not in the minority with this. This is probably more often than not, and we could talk about the reasons why, and we will. But how many people out there have gone to physical therapy and then not known who their physical therapist is?
Probably a lot of them.
Probably a lot. And we've talked about the why. You know, insurance is really like they keep reimbursing less, which means physical therapists have to see more and more people. And some clinics, they'll see 4 to 5 an hour. And I've worked at those clinics. I've worked at a clinic where this was about maybe 15 years ago. I worked at a clinic that I would see 4 to 6, sometimes more an hour.
Jeez.
Right? And I mean, if you break that down into time components,
It's
right?
like 10 minutes a person.
It's like 10 minutes. Well, it's less because you have to count like, I don't want to say travel time, but like, you know, like you have to look at a chart before you see that person, right? Maybe you have to go to the bathroom, shove some food in your mouth, right? So like all these little things.
So it's like 5 minutes.
All these little things that take up extra time that you don't necessarily count for, right? One patient takes longer, and then you have to kind of chisel that away from other patients, right?
Yeah.
And I would say most clinics don't see more than 3 an hour. I would say that's rare, but it's still out there, right? I would say even the ones that see 2 an hour, which is probably most of them. Probably most of them see 2 an hour. Most of them don't have any like as much support staff. So like a tech, a front office, something like that, that's specifically helping you. Mm-hmm. You know, you might have a tech that's helping 30 different PTs or a front office that's helping, 10 to 15 different PTs, but primarily it's you alone managing these 2 patients, right?
Yep. That's what it looked like in my experience.
So you have to either they're scheduled at the same time, on the hour every hour, or they're staggered. But either way, like you have to manage it, and you have to also do a pretty like abundant notes. Like the notes that we get pounded to us in school, like that if you don't write enough information or the right amount of information or do enough measurements, number one, your liability, right? Like to get sued, which is a lot less common than school makes it out to be. But number two, you might get denied insurance. And so that's probably the biggest issue. That's probably the real issue there.
Yeah.
And why, like if you don't have enough objective measurements, if you don't have enough stuff in your notes, the insurance company will deny treatment. So now that's probably why most of the time when you go to physical therapy, I would say the majority of the case, you start with some form of warm-up. And that warm-up is either walking on the treadmill, riding a recumbent bike, doing an arm bike, a UBE, upper body ergometer, right? Or sitting on a hot pack in stim. Either way, that's about 10 to 15 minutes of your time because it's a certain amount for the setup and breakdown and a certain amount while you're on it. And you have to be on it. By the way, how long was your daughter on the treadmill?
I don't know, like 10, 15 minutes, yeah.
And you know why?
To charge for it?
You need enough time to charge for it. Yeah, if she was on it less than like 8 minutes, and I'm being a little generalized here, but if she was on it less than 8 minutes, you couldn't charge for it. So same thing for the hot pack and stim. Same thing for like these. Same thing when the PT's with you. You
It's just busy work.
Certain
It's
amount
just
of
busy work.
It's just busy work, right? Because they're off doing their note.
Yeah.
They're off doing their note, or they're off seeing somebody else. Okay, so you're kind of set up. I would say that the flow that most clinics are in, you're getting really not one-on-one attention, and then when you do finally get it, now depending on who you're seeing, there's a wide variance of, and I'm going to put in quotes here, treatment.
Okay.
And I'm putting that in quotes because this happened to me. I'm an 18-year orthopedic specialist, 4 advanced certifications in orthopedics beyond my doctorate, right? Started and grew my own practice. My wife's a physical therapist with a whole bunch of certifications herself and specializing in women's health. So I say this to say that I've been around. Mm-hmm. And this was relatively recently, within the last 6-7 years, I got to the point where I was realizing that a lot of the treatments that I was doing, quote unquote, weren't actually treatments. And so we can kind of agree that your body needs 3 things, right? Your body needs movement. Okay, you need to have flexibility, range.
Sure.
You need to have strength in those ranges in order to move, in order to be stable, in order to be strong, right?
Yep.
And then you need to do that without any symptoms, and we'll call that pain.
Okay.
So you need to be pain-free, right? We really just started focusing on that last one. We want to get you out of pain. We want you to not have any pain whatsoever. So that's what the hot pack is for, to promote blood flow to the area, to warm up your tissue beforehand. Yeah. That's what the TENS unit is for. A TENS unit just numbs you to your symptoms, just makes your symptoms less, your brain can't perceive it, right? That's what massage will do. That's what trigger point will do. That's what Graston will do. So when they take that tool and they scrape it along you, it's gua sha or Graston, whatever you want to term it, or IASTM that people will term it, right? That's what cupping will do. That's what acupuncture will do. That's what trigger points will do. All of this stuff is just managing your symptoms, just managing your pain. And we forgot that if you promote full range of motion and you promote strengthening into those ranges, that is what will lead to pain-free. So when you go, we're just primarily working on making you pain-free, but not actually fixing the underlying problem.
Sure.
Thank you for watching the Spinal Truth Show. I hope you're finding this information helpful. If you're out there and you're still in pain and you're looking for relief, we have some solutions for you. You can schedule a consult with me or a session, but if that's not in the budget, we also have some options that are self-guided at home. You can go to thespinaltruth.com. We have courses set up right now for arm pain as well as for neck pain. They are geared towards you. They are a 4-week course, 60 videos that are self-guided by an expert in the field that you can do from the comfort of your own home at your leisure. They will take you through step by step the typical approach that I take with patients. The expectation is that they will provide significant relief over these 4 weeks. So if you're looking for something better, something different because you're not finding the relief, go to thespinaltruth.com, sign up for one of these courses, and get the right treatment, see the difference.
Even if the physical therapist gave an exercise that may fix the underlying problem, the way that system is set up is you're going to perform that while they're over there doing something else, not even watching your form.
And you're not going to do it right or know to do it enough right. Or yeah. Yep. And again, I've been in this field 18 years. I've seen it a bunch. I've done it. I've been a part of it. I've done everything that I'm now telling people not to do, right? Most of the time, a lot of clinics are set up where you go in, you get your exercise sheet, you have 12 to 18 exercises on the sheet, you go your little circuit, you do your little routine, you check in with somebody before you go, and then you're out.
Yeah.
And you do that 2 to 3 times a week for 4 to 6 weeks, and you see if you get better.
Yeah.
And most of the time, these patients, by the end of 4 to 6 weeks, they're not sure what the physical therapy was doing for them. They're thinking like maybe it was helpful, or maybe they just got kind of better over time, or they just got used to their symptoms. So if you're out there and this is you, I get it, I hear you, but this isn't what I mean by physical therapy. This isn't the physical therapy I want to eschew, or
Yeah. I mean, there's an element to it of like just the mental component of like, well, I went and showed up for 45 minutes weekly for this thing, so I'm putting in the time and effort.
Yeah.
You know what I mean? But it's like you're not really doing anything while you're there.
Yeah, somebody's coming along to stretch you, and then they're
Yeah.
showing stretches. And I disagree with stretching by large and apart. And we just did an episode on stretching.
Sure
right?
did.
Where I used to do this too. I used to do all this type of dynamic stretching, and or I would do contract relax or longer hold times or under more strain stretching, and then show the patient how to stretch themselves, right? And I realized that it wasn't really addressing the underlying cause. It wasn't causing lasting change. And you think, when you think range of motion, you think stretching will improve range of motion, but it really doesn't. It's active contraction. And we did that whole episode. But going to getting all of these exercises, not really sure what they're doing, not really sure who you're seeing. Most of the time, physical therapy, we do a pretty good job of sticking you with the same physical therapist, but people go on vacation.
Sure.
And there's certain, they only work 40 hours a week. But you might have to come in at this night on this day because of your schedule.
So they're not there.
There's some scheduling issues, right? And it's hard to talk between therapists and certain therapists. Every therapist has their own little different tilt, and that's probably a thing that we do pretty bad in the physical therapy world. Based on what your clinicals were in and who you worked under and stuff like that, you have your own specific area, niche, and the way you look at something, the way you treat, and it's vastly different from one therapist to the next.
So, was it always the procedure of physical therapy is like you come in and you start walking on a treadmill and doing this palliative stuff?
I don't know about always, but probably.
Okay.
There's so much of this because we didn't talk about like paraffin, like a paraffin wax. Like if you're coming in and you'll put your hand in some wax, you'll dip it like a candle 5 times, and then they'll wrap it with a hot pack. It's primarily for surfaces that are a little harder, like a hand, to get to all the surface area of it. There's something called fluidotherapy, where you'll stick your arm in this machine that blows warm sawdust around. There's like sawdust in the machine, and it blows warm air. It's just to warm up. It's just to warm up. But all of this stuff that you can kind of charge for, and that sounds like
they're doing something.
Fluidotherapy sounds. Yeah. Paraffin. You didn't know what that was?
No.
Like ooh, what's paraffin? Right?
Yeah. Yeah.
All this stuff, and it makes sense to warm up, and right, and it makes. But you know what warms your body up better than all of this stuff is movement. Active movement warms it up better, more specifically, and then you also get muscle contraction, which helps you stay better.
It's like I almost feel like you would get better treatment care by going to a gym and getting a personal trainer.
Yeah.
More direct.
I think the biggest thing that most physical therapists do is just show you how not to make your problems worse.
Okay.
Like they'll teach you that. They'll teach you, but it's kind of one of those like, well, if it hurts, don't do it, or do it this way, which is more of just like an around rather than getting at the root cause.
Yeah, it's like this is your problem, so we're gonna make it not get worse.
Right.
We're not actually gonna fix the problem.
Yeah, and they're trying.
Sure.
But that's another thing about physical therapy that you need to know as a patient is we are not all the same. We go to 4 years undergrad, and during that time, you're pretty much learning nothing that for treatment. You'll do some anatomy and physiology and stuff like that, but then you do your 3-year doctorate. And during this time, you're learning how to treat patients. But you're learning how to treat patients, you're learning women's health, and you're learning oncology, and you're learning about cardiac health and pulmonology, and you're learning about wound care, and you're learning about inpatient and outpatient and skilled nursing and long-term, and you're learning about SNF, and you're learning about aquatic therapy, right? So it's 3 years of learning all these different, and so you get out and you know a lot about, a little about everything, but you're not an expert in any one of those areas. You learn a little TMJ, you learn all the different parts of the body and a little bit of how to treat, but you really haven't taken a patient through treatment, you really haven't applied it for the most part, only in your clinicals. So you have 3 to 4 clinicals, but depends on what you do your clinicals in, and only one of them can be typically orthopedic. You have to pick like an orthopedic, and then you have to pick like an inpatient, like a hospital-based rehab, and then it normally make you pick one or two other ones that are generally different. So you come out, and it's really only based on like who you worked under that's your approach now.
You're just kind of mimicking what you learned.
Just kind of
from
mimicking,
that
and
person.
that's everybody, right? That's
Sure.
everybody. But I'm saying
anytime you apprentice, yeah.
Yeah, but I'm saying it's so scattered and so all over the place. Like it's just like going to your primary care, and then asking them about, your orthopedic condition. You wouldn't expect that they'd have a great answer, right? They'd have to send you an orthopedist. It's kind of the same with the physical therapist. So if you're going for orthopedics, just remember, like in orthopedics is your bone and muscle primarily, right? So just remember that this person had all this other stuff too, and they might not be a specialist in this area. And among physical therapists, less than, I think, 20% are actually specialists in their given area that have a specialty certification after their doctorate. And I understand why they don't, because it takes a lot of time and studying, and depending if you do like a residency program, it takes a lot of money. It's like 20 grand just to do this residency program for 1 to 2 years to then take this test and get the certification.
It does nothing to increase.
It does nothing to increase what you get paid.
Yeah, because nobody out there thinks there's a difference between a physical therapist here and a physical therapist there.
Yeah.
Like, you know what I mean? All those degrees and certifications, I don't think anyone ever really even thinks about it. So like, I'm going to physical therapy. I'm going to go to Jack's physical therapy, or I'm going to go to Jill's physical therapy, whatever one's covered by my insurance.
And do you know how they pick it more often?
It's closest.
There you go. Whichever's closest, which I get,
Yeah.
because if somebody tells me 2 to 3 times a week for 4 to 6 weeks,
Yeah, they're like, oh,
you're
Jesus,
talking about
I can't drive an hour.
12 to
Yeah.
8, or we'll say 8 to 18 visits,
Yeah.
right? And you're like, I have to drive. If I have to drive an hour there and an hour back, if I'm doing 18 of those, it's
Yeah.
18 hours or 36 hours of my life.
Yeah.
Versus like if you go see this one doctor specialist that you might have to drive to them once or twice.
Yeah.
So you're more willing to go 2-3 hours away or whatever. So and I get that, but that really limits who you can see.
Yeah.
So you're limited on geography, and then you're also limited on insurance.
Yeah, and then there's also, well, my primary doctor says go here, so that's where I'm going.
Mm-hmm.
So yeah, there's a lot of, not a lot of thought maybe put into it because of just how we see physical therapy.
Yeah, and you think it's pretty much all the same. It's pretty much all the same. So whoever my doctor said, and who's ever closest, and whoever takes my insurance, and I understand that goes into the decision making. It should, right?
Yeah.
But you should also be getting the care that you need. And by large and away, and I hate saying this, I'd say 90 to 95% of the treatments and the type of physical therapists out there, I disagree with.
Yeah.
I don't think they're good enough to have the effect that I would want to see. And it took me probably 10 years of really trying to like work on what I was doing and how I was doing it, and trying to get these advanced degrees in order to try to get better at my craft and also treat my own pain. We did a podcast about that, about like the symptoms that I was trying to treat for myself. It probably took me about 10 years to get to the point where now I was doing it effective enough that that's the way it should be.
It's the 10,000 hour thing.
Well, 10,000 hours is 5 years typically, because if you work 2,000 hours a year, it's 5 years. I had specialty degrees before that 10-year mark, but it was really where everything like kind of coalesced, and I started to see things a little bit differently and started to treat a little bit differently, and I got to the point where I expect to see changes on the first visit, relatively drastic changes for a majority of the patients that I'm treating. Versus I remember being a new grad, even the first few years, where I was monitoring change over weeks.
Wow.
Where I'm like, all right, well, we'll see in 4 weeks, we'll reevaluate and see where you're at with this treatment plan. I'll set this plan and we'll monitor it during that time and make adjustments and progressions, of course, but like we'll really evaluate its efficacy in 4 to 6 weeks. Whereas now it's every single visit for me. Now every single visit, I'm assessing, I'm changing, and I'm expecting it to have an effect. And either during that visit or at the very least by the next visit.
Okay. So if you're out there and you're looking for a physical therapist, what should you look out for?
There's a few that I like better. The top that I like, and I don't agree with everything that they preach and practice, but is a physical therapist that's certified in McKenzie Physical Therapy. And it'll say MDT at the end of their name. It'll be initial, it'll either be CERT, C-E-R-T dot MDT, so that means Certified in McKenzie Physical Therapy, or it'll say DIP, a diplomat of McKenzie Physical Therapy. It's a little higher up, actually. There's a website. It's either the McKenzieInstituteUSA.org or McKenzieInstituteUSA.org.
Yeah.
I forget if there's the.
Just Google McKenzie Physical Therapy.
That you can. It'll have like a find a local provider.
Yeah.
And they're a little few and far between, but there's probably one in your area, and there might be one that is a little far away, but it's probably worth going once or twice to have them show you some stuff, because they too are also expecting to see some changes, maybe within session or relatively quickly.
So, what makes them different?
They focus on the spine. They have a strong focus on the spine, and then they have a strong focus on like one or two movements, and then they really, really work those one or two movements. And this is something that took me way too long, but like I would give you 10, 18, 24 exercises. Like I'd fill up your sheet, right? How much can we get through in a session?
Yeah.
And then how much do I think you could do at home, and how many of these like are really helpful that I want you doing at home? And I'd select 8 to 10 of them, right?
Jesus.
And that's probably common. And now I'm at the point where I give like 1 or 2.
How would you even know what's effective?
How would you know what's effective? It's not all of them can be the absolute best for you. And then you have to factor in like time and effort, right? Like I don't have enough time and effort to do 10 exercises a day, every day, once or twice a day,
No.
right? And at a certain point, I'm setting patients up for failure there.
Yeah. It's
right?
overwhelming. I'm not going to do it.
But 1 to 2 exercises, and then I really work on progressing those, and I see what value they have, because if they're not having value, then I move on.
Change, yeah.
Right? That's much more manageable and more reasonable for the patient to do. Hey, just a quick break here, and then we'll get back to the show. If you're out there and you want to see if this is the right approach for you, you can schedule a consult or a session with me. Go to thespinaltruth.com. At least set up a consult. Within 30 minutes, I will listen to your symptoms. I will go over your history. I'll go over what the approach I would take for you and the results that I would expect. My goal is to save you from continued pain, failed treatments, and prevent you from getting surgery. So go to thespinaltruth.com, set up a consult, and let me go over your symptoms. Now let's get back to the show.
That is the thing. Okay, so you come into here, we spend an hour doing an evaluation, which is just talking, figuring out where your symptoms may be coming from, all that stuff.
And during that evaluation, we're doing treatment.
Treatment, yeah. Okay, but then the next week you come in, we go back through all your symptoms again and evaluate and see what changed.
Right.
And I feel like watching my daughter go to PT, that conversation was, how you doing today?
Yeah.
And it's like, what? How is that?
And most of the time, the
Evaluating
patient's
what's
going to say, okay.
Yeah.
And
Or
that's
my
going to
hand,
kind of be the end
yeah.
of it,
Yeah.
and then they're going to settle into their typical treatment,
Right.
right? Versus me, I make them like better, worse, same.
We go through all the data.
We go through all the
that
data
we,
points. Yeah.
Came up with during the evaluation.
Yeah.
So there's your data that is objective.
And it took me a while to learn how to do that, to be honest. Like
Yeah.
it took me a while to be an expert at that.
Yeah.
At distilling that information, that useful information that the patient's giving me, and then putting like data points onto it and checking in about it. It took longer than it probably should. I can teach this now, and I have, right?
Yeah.
So it's teachable in school, but the school doesn't really set you up for it. They have their own thing, and I don't know.
Well, it's got to be one of the most important elements of treatment is realizing what is effective and what isn't. And if you're just throwing 20 exercises at someone, not really evaluating their symptoms to begin with, and then not following up a week later on how their symptoms have been affected, plus with all the exercises, there's just no way to pinpoint what actually works and what doesn't.
Well, and I'll go one on top of that too, because I agree with that. And then if you're also not working on the area of field that you've chosen, orthopedics, home health, whatever it is, you're not going to get better as a PT. And a lot of times we just aren't doing that. And PTs out there listening to this are like, well, we go to we go to courses, right? Like you have to do a certain amount of continuing education every 2 years. It's a relatively low amount, like typically one course covers it. And you can do these like online courses and stuff in order to cover it. So like there's a lot of ways that you can still fulfill this 30 hours of CEUs, continuing education units, over the course of 2 years with really not learning anything.
Yeah. I mean, I know someone who works in a doctor's office, and the way they speak about the doctors is that it's half and half, where it's like half the doctors show up to work and they treat it as if like, whatever, I'm doing it, getting it done through the day. And the other half treat it as like, I'm trying to help people. And so I'm not here to judge, but like how many people in physical therapy, they go to school and then it's just an assembly line of people rolling through and them just doing the things they were told that are
And saying that's good enough.
ineffective, and it's like,
Yeah.
that's it, I got to move on.
And to their credit, they went to school for 4 years, then they went to school for 3 years after that, so it's
Yeah.
longer than most people. They are now $200,000 in debt,
Yeah.
and when they get out, they're not making as much money to overcome that $200,000 in debt. And then beyond that, they're not incentivized to continue their craft, because like I said, if you spend that 2 years going back and getting your, so for orthopedics it'd be like your OCS, your orthopedic certified specialty degree, right? Like there's about 12 of those. You neuro, women's health. So my wife has her woman WCS certified specialty, right? You spend 1 to 2 years in a residency program, or just studying on your own, and then taking this test that by the way, you have to pay about $1,000, $1,500 for this test. At the end of doing all that, you get paid exactly the same.
Yeah.
Exactly the same. And not only that, the patients don't know the difference.
Yeah.
The doctors don't know the difference.
Yeah.
So now you have your OCS and you're feeling pretty good about yourself. And you should, because you worked hard to do it, and it's more than most people do. But you're not getting paid anymore. The patients don't care anymore. Like you don't care. They don't know.
Well, okay, so you have, how many of these do you have?
We'll call it 4.5.
Okay, you have Maitland.
Yeah, so I have my COMT, so it's a Maitland certification,
Okay.
For like manual physical therapy. So
Okay.
a lot of like mobilizations, manipulations, stuff like that.
Then you have Mackenzie.
I have my Mackenzie's, so it's Mackenzie's degree, where it's a lot of spinal mobility exercises and movement patterns and stuff like that. And really they break it down into a very linear thought process of evaluation and treatment application. So I like that.
Okay, and then what are the other ones you have?
I have my fellowship. And the fellowship, it's 3 years. It's somewhere around $30,000, and it involves about 14 courses that I had to go to. I had to go spend, I forget, 150 hours underneath another fellow training.
Okay.
I had to do papers, blah blah blah.
Okay, and what's,
My OCS, my orthopedic certified specialty. That was
Okay.
the first one I got.
and then you have a half of?
I have a Titleist TPI certification, so
Okay.
it's like this golf evaluation. So we don't need to count that one.
All right, but okay, so you did all that. Can you charge more because of it?
Nope. Can't charge more
And do you
because of
think
it.
anyone notices or knows?
No, most people, and all those abbreviations I just mentioned, even a lot of physical therapists won't know what they mean.
Yeah. How many physical therapists have all those? Would you guess?
I don't know, 1 out of 10,000.
So very, very few have that many certifications in the field.
Yeah, I mean that'd be a guess, but yeah.
So let's just say you're in the top 10% of physical
Oh
therapists.
no, I'm in the top 1% of the 1%.
All right, so you're at the very top of like the amount of certifications and extra learning and all that stuff, and you can't charge any more than Joe Bob down the street who just got out of physical therapy.
Well, and I'll even do you one better. Not only can I not charge more, but if I were to take all these certifications and go apply for a job, I don't get paid anymore for it either.
Because it's not valued.
Because it doesn't have value. Yeah, it doesn't have value it has value to the patient. Because I've done all that,
You can do better treatment.
I can do better treatment.
Yeah.
Yeah, and my treatment just kept getting better and better and better. Obviously, the more experience, but the more I also focus on it outside of. There's a difference between being at work and then working on your job, right? Like working on your skills. Like for you, like there's a difference between you editing videos, but then you looking up like how to do this differently and how to do this and gaining these like skills, and that takes time and effort. in order to do it. But once you go through that, now your video editing gets better.
Well, yeah, if you're a director and you've never edited anything, then you are a far less competent director because you don't know how things come together, so you can't direct knowing what you need.
And for a lot of physical therapists too, that's the case. Like they're physical therapists, but they haven't seen this specific diagnosis, and they'll shy away from it.
Yeah.
So a lot of physical therapists they won't treat TMJ, or they won't treat feet, or they won't treat hands, right? Like I would say those are probably the three more common orthopedic problems that a physical therapist just might not treat. Some physical therapists won't do vestibular, so like dizziness and stuff like that.
And that's why we do get pushback from physical therapists, because they go to school, they learn something, come out, and you're saying something against that, which is their whole philosophy, their whole, this has been ingrained in their mind that this is how it is. Can't question it. But you've been doing this now for almost 20 years. You have all these extra degrees, all this fuller understanding of the field, on top of thousands and thousands of hours of experience of what works and what doesn't. You can't charge anymore. But when you push back on some things, that's when it's a problem for some people.
Yeah, I don't know.
Like any other field, I don't know, you would think it would be more respected, as you get into these niches.
As physical therapists, we have a very kind of toothless APTA, a governing body. This is the story, but we lost funding because of a comma. There was, it was supposed to be PT, OT, speech, something like that, and there's supposed to be three separate issues.
But now you're PT-OT together?
But yeah, now we're lumped together, so whatever Medicare was giving got split between us instead of each individual. And this is just an example, and this is a story that I was told, but it kind of it has a
rippling
sound
effect
of truth to it.
All right. So,
so my wife has to recertify her PRPC right now, PRPC or WCS. Either way, it's a pelvic floor certification. She has to pay in order to take the test. She has to pay in order to get the study materials, and she's already done it. She already has it. She has to recertify for it. It costs more now than it did before, and it does nothing for you. They don't maybe they'll put you on a website or something like that, but nobody even knows where to go or
nobody looks for
nobody
that.
looks for it. Yeah.
Well, that's the boiling it down. That's the problem. Is if I get told I need to go to physical therapy, I don't know to look into any of this. I don't know that this physical therapy actually has a better, more comprehensive understanding for something that would affect my treatment than this one. All I know is that I need to go to physical therapy, and this is the closest one, and this is the one the doctor says I should go to.
And for me, I was seeing this, so that's why I was going to get all these degrees, and also we were starting our own practice, and I needed our practice to succeed, and I thought the best way to succeed is by giving the best care, right? So I was I'm going to become the best physical therapist in the world, so way.
That is wrong, because if you treat people and you make them better, they don't come back.
No, it was helpful because they'll tell friends and family.
Sure,
and
but you know what I'm saying? It's not the same assembly line, it feels like.
So it's not the best business model, I'll say.
Yeah, that's it.
Because you're right. You're better off if you just focus on how many times you can see somebody.
Yeah.
Right. You'll get more money.
Yeah.
And then if you have that mindset, then you're focused on the type of patients that you want, what insurance they have and what diagnosis they have. If you get a total knee, right? They're there for. Most of the time, they're there for three times a week for the first 4 to 6 weeks, and then another 2 times a week for another 4 to 6 weeks, and it's a very simple and easy rehab program to do. It's a total knee, right? And a lot of times they're Medicare, so you're just that's what you want. You're putting them on the bike, you're putting them on the treadmill, you're putting the hot pack and stim on them, so it's 30 minutes worth of really non-skilled care. And then the other 30 minutes they're doing a lot of exercises on their own because it's primarily them moving. You do a little stretching, a little scar tissue mobilization, a little patella mobilization, a little kneecap thing, and then there you go. And
saying it like that, it sounds wrong. It sounds like, what are you doing? You're taking advantage. That's how you're taught. That's how you're taught supposed to treat.
Right.
Yeah.
Yeah.
So it's not like they're thinking they're morally taking advantage of someone. This is just what they're taught.
So and again, I got to the point where I'm looking around and I'm that's not treatment, that's not treatment, that's not treatment. And then beyond that, I'm looking around and I'm looking, that diagnosis is wrong. That diagnosis is wrong. That diagnosis is wrong. Like,
Yeah.
So not only are they applying not treatment, but it's not treatment to like the wrong area. So many people, it was an underlying spine issue. It wasn't a rotator cuff issue, it was a neck issue. It wasn't a labral tear, it was a neck issue. It wasn't a labral tear, it was a low back issue for their hip. It wasn't a meniscus issue, it was their back. It wasn't plantar fasciitis, it was their back. And this was happening over and over and over and over and over again, to the point where it was like, it was comically frustrating.
Yeah.
And all the diagnoses that were coming in, they were basically all wrong.
Yeah. There's the other element of, my doctor said I have to go to physical therapy so that I can fail physical therapy so I can get the surgery that I just really need.
And that happens a lot.
And it's like, why even bother? Like,
I write about this in the book, like, about the way insurance is kind of getting in the way.
Yeah.
And we talked about, insurances with physical therapists. That's why they're seeing 2, 3, maybe 4 an hour, and that's also too, because we don't get reimbursed better for more skilled care, for more advanced care. That's why they're not getting these advanced degrees or certifications, right? What was my point? What did we?
That you're just there to fail so you can get your surgery.
But then the insurance company is also saying, like, hey, you need to fail physical therapy before you get this injection, before you get this surgery.
Yeah.
And the doctor, trying to do right by their patient, like, gives them this information where, hey, you need to go X amount of times. It depends on your insurance. Like, some of them would just be 1 visit. Some of them it would be 6, right? You need to go. The patient knows this. They're only there to fail. And then they're out, they go get and they say physical therapy didn't work. And
Let me ask you this, and this might not be a question you can answer, but out of the things that people get sent to physical therapy for that end up in surgery, like how much surgery could be avoided?
a lot of it. Well, 80+%.
So there's just people out there, so many people I know getting like neck views.
If they got the right treatment early enough, absolutely. It might even be higher than 80%. And obviously this is such a hard number to apply.
Right, that's why I didn't know.
But
a
significant amount of surgeries or procedures, like whatever nerve ablations, epidurals,
All that stuff.
all this stuff could be avoided. A significant amount. A lot of them are unnecessary in the first place, let alone ineffective even when they do actually get the surgery.
I just don't understand the people out there who go to the doctor, go to physical therapy, end up getting something fused or whatever surgery-wise. 6 months goes by, the pain comes back, and then they repeat that process. And don't question.
And that happens a lot.
Don't question where the failure was.
A lot. And they'll go back to that same doctor.
Exactly.
Because that doctor is the best. Every single patient has the best doctor.
Best doctor. Yeah, because we don't want to think that we got it wrong.
Yeah.
But like, no one wants to think I got a surgery for no reason.
But unfortunately, thinking that it's always for a reason and they're always right is what leads us down this road.
Sure.
Right? Not questioning it and not knowing to question it. And hopefully that's what we're doing here. Hopefully that's what we're...
So, if you're going to physical therapy and you've seen them 2, 3 times and you're not seeing a difference?
It depends on over what period of time, right?
Okay.
So I would put it at around 4 weeks.
Okay.
Around 4 weeks, if you're not seeing a difference, a relatively significant difference.
Okay.
It would have to be like above 25%, but hopefully closer to 50.
All right. So I'm going to physical therapy for 4 weeks. I haven't seen much of a change. They want to do surgery.
It depends on your symptoms. Most of the time, I would say, no, still absolutely not. You need to find another physical therapist. You need to find somebody different, right? You need to find a different approach. You need to find somebody that's going to spend time looking at you and giving you the information that makes sense.
Is there a way to determine, and I guess it's a per person thing, but like what are common things that people get surgeries for that should be avoided?
Most shoulder surgeries.
Most shoulder.
Most shoulder surgeries, rotator cuff tears, labral tears, bursitis, tendinosis, tendinopathies.
Carpal tunnel?
Yeah, I was just specifically naming shoulder.
Oh,
though.
shoulder. Okay,
impingement, bone spurs, all that stuff. 80 to 90% can be avoided.
Speaking of bone spurs, that brought me to MRIs and imaging. So in typical physical therapy, how interested are they in MRIs?
They will let that guide their treatment.
Gotcha.
Most physical therapists will let the doctor's diagnosis guide their treatment. The doctor diagnosed degenerative disc disease, or meniscus tear, or plantar fasciitis, or whatever. So in their head, they're treating plantar fasciitis before they're even seeing the patient.
That's crazy. Because who's diagnosing that? The GP?
The doc. Well, it depends. Yeah, a lot of times it's just the general practitioner, your primary care.
That's like me going to my general practitioner. They're saying you have ocular degeneration or whatever, and then me going to my eye doctor and then don't even bother to confirm that.
No, but that's what's happening.
Yeah. No, I know. It's crazy. It's
they're
crazy to think about.
And they have plantar fasciitis treatment in their head, and they're like,
Well, I know what
copy,
to do.
paste.
Yep.
Here
This
you
is
go.
the typical treatment we do.
This is the typical treatment. If it works, great. If it doesn't work,
need
then you go
surgery.
back. You need an injection. I'll refer you back to the doctor. You get to look good as a physical therapist if you refer back to the doctor. If you're trying to make connections, right?
Yeah.
So you get to kind of look good. Be like, hey, what else could you do? I couldn't help, And that actually, unfortunately, that helps the physical therapist or that clinic anyway establish a relationship with the doctor.
So we have pointed out some things, though, if you're out there listening, that you can do to help advocate for yourself, that you can do to help find better treatment that actually works.
Yeah, and a few quick OCS, a few quick titles. OCS is one that's good. Again, McKenzie certification, so MDT at the end of their name is the best, in my opinion. COMT at the end of their name, it means certified in orthopedic manual therapy, that you can do it through different platforms. I did mine through McKenzie, or Maitland, sorry. But either way, that means that they're better with their hands.
Okay.
And then a fellowship.
So when they're doing a physical evaluation on your spine?
Yes, but then also when they're mobilizing, manipulating you, stuff like that.
Okay.
They've gone through a lot of these. In school, let's say cracking your back. There's a 1 hour module that you'll spend on that, cracking somebody's back or neck or something like that. And maybe you do 1 to 2 of them. So you practiced it for a period of 2 to 3 hours during your schooling. Mm-hmm. That's not enough.
No.
That's not enough to...
Doesn't sound like enough at all.
No, that's not enough. And some won't even do a lot of it.
Yeah.
Right? For me, in school, and this is probably still the case, it's been 18 years now, but McKenzie was actually really mocked and made fun of. And that's why I didn't go to a class until we started our own business. And the only reason I went was because it was better known throughout the doctor world. So that way I was hoping to help get more referrals because I had my McKenzie certification, because doctors, that's the one that they're more familiar with, if they are familiar with it.
Gotcha.
Right? And I was really taken back about how effective it was. And really that's what kind of started my whole philosophy. And I used that as a jumping off point, and I blended a lot of the other things that I learned into that philosophy. And that's kind of where I came up with my own.
Okay.
So if you're seeing those certifications, that's if you have an orthopedic problem, right? If you have shoulder pain, hip pain, back pain, knee pain, whatever.
But you're seeing that someone went far beyond their doctorate, assuming to give better treatment.
Yeah.
Because they're not doing it for a financial gain. So that would be the only reason.
No, we're not incentivized at all.
Yeah.
Yeah.
So look for maybe those.
Start to question your diagnosis, and we talk about this a lot. If there's numbness and tingling, it has to be a nerve issue.
Yeah.
Right. If it's bilateral, and when we say nerve issue, we're really primarily talking, at least at first, if you're going to evaluate somebody, looking at the spine.
Yeah.
If it's bilateral, more likely if both shoulders hurt, both hands hurt, it's not bilateral carpal tunnel, it's a neck issue.
Yeah.
Right. Same thing with your knees. Might not be degenerative joint disease or a meniscus issue. It might be coming from your back. So having that looked at, right? Or just understanding this. So numbness or tingling, bilateral, if it kind of comes and goes. Some days I can play tennis and it doesn't hurt. And other days I play tennis and it hurts. That's more disc nerve than it is muscle, tendon, ligament. If it's there at rest, if you're getting your elbow pain, your tennis elbow, just sitting at your computer, it's probably not tennis elbow. It's probably your spine, because it's the position your spine's in.
Yeah.
If you're not responding to treatment in that area. If you have elbow or hand pain and they're treating your elbow or hand and it's really not doing anything,
Probably not that.
might not be your elbow or hand. And just knowing that, hey, a spine issue can really mimic all of these symptoms and conditions, and it's very likely to get misdiagnosed. And now you know that, hey, the diagnosis came from a GP who really doesn't know anything about orthopedics, and then got to the physical therapist who really didn't look further beyond that diagnosis, and then applying treatments that really aren't treatments, they're just managing my symptoms. And so just knowing all this, and now you know after 4 weeks why you didn't get better in the first place.
And then I would also state that if you get an MRI done and it says you have bone spurs or degenerative disc disease or something like that, that doesn't necessarily mean it's a problem.
No, that understanding that all of that stuff is there in asymptomatic patients and patients that have no symptoms whatsoever, that stuff is more than likely to be found.
But that does not mean it's a problem.
So it doesn't mean it's a problem,
Yeah.
and if it is found, it doesn't mean that that is your problem.
Yeah.
Right? And if it is found and it is your problem, it means that that is likely treatable without it completely going away, right? Like treatable meaning we can treat your condition, your symptoms, your pain, your limited range of motion, stuff like that, and that
still have that.
That will get better, but if you go back and you get another MRI, you'll still have degenerative disc disease. But if you had no pain, if you had full range of motion, you could do whatever you wanted to do in your day without any problems, and I told you had degenerative disc disease, would you get an injection?
No, of course not.
And by the way, an injection that does nothing to treat
Of course not.
in the first place.
Yeah.
Would you get surgery?
No.
No. So just because you have a herniated disc, you can still have that herniated disc, but be better, but be fixed, right? Without surgery, without any type. Or you could also have that herniated disc, and that's not your problem.
There you go. Physical therapy. Hopefully that knowledge helps you to advocate for yourself out there and get proper treatment.
Yeah, I love what I do. I think what I do has a lot of value to prevent surgery and to prevent, but I don't like the way my profession does it in general. And there's a lot of reasons for it: insurances and money and time and this. And I really do have a different view on the body and rehab than I used to, and I had to work really hard to get there.
Well, and the place we're at here now with the Spinal Truth can't just happen. You couldn't just do this now. The only reason we can do this way of treatment right now is because you own and have built a career and own all these other clinics, right?
Right.
Because starting out, this would not be
It's not profitable.
You would have to do 1 million patients and all this stuff. Yeah.
No, this very likely isn't scalable.
No.
Right.
Unless your clientele's high end, very and charge ridiculous amount for it, right? Yeah.
Right.
It's unfortunate.
So I see a better way. I see a better future, and I'm hoping to cause some of that change.
Yeah.
But I also understand how much we're behind the 8 ball with it. And that's kind of what I want to share for the patients, because you get so many people that I failed physical therapy. Like, no, physical therapy probably failed you.
That's it.
Yeah.
All right.
That's our show about physical therapy and the current state. If you have questions, reach out to us: Instagram, Facebook, YouTube, TikTok, and then our website, thespinaltruth.com, to set up a consult or a session, and then also for some online courses at home that you can use to treat yourself.
That are your treatment.
That are my treatment philosophy. Yeah, we'll take you through.
And they are affordable.
They're affordable and they should be effective.
Yeah.
Yeah.
All right.
All right. See you next week.